A very good evening to all the viewers of Michael and One India. When it comes to a weekend fun football match, or for that matter, even amateur level sporting activities, the knee, of course, plays a very important role. It becomes all the more pronounced when top-notch, high-performing athletes perform at the best at high-end competitions like the Olympics, Asian Games, Commonwealth Games, you name it, any. Uh, in all these cases, the anterior cruciate ligament, which is commonly called the ACL, of course, plays a very important role in keeping the knee intact, up and running. Today, we have with us a very distinguished sports medicine doctor, and he who happens to be one of the best ACL specialists in the country. And in fact, maybe I can safely call him our Olympics doctor because under him, the treatment that two of the stalwarts of Indian hockey, Harmanpreet Singh, who happens to be the captain of Indian hockey team, and Gurjant Singh, they both not only recovered under his treatment from their ACL injuries, but they have also went on to win the medal for us at the Paris Olympics. Apart from being a top-notch orthopedic and sports medicine surgeon at Fortis Mohali, he has also, he also has many other prominent hats. He is a young ambassador for Asia Pacific Orthopedic Association, UNE Young and Distinguished Alumni, and Royal College of Surgeons of Canada, International Resident Leader, and many more. Welcome to our show, Dr. Manit Arora. Thank you so much for coming in. It's really a pleasure and privilege to have you here.
Thank you. Thank you so much for having me.
Sure. So, of course, you have been closely associated with Olympics, which has just we've just done with the Olympics now, and I'm sure it's quite satisfying for you to see two of your athletes, Harmanpreet Singh, the captain of an Indian hockey team, who of course is sometimes called Sarpanch, and Gurjant Singh. They winning the medal for us. I'm sure at a personal level, it must be very satisfying for you.
It's very satisfying, but I never watched their games because I started watching them a long time back when I did their surgery, and but then since then I'm just too scared to watch them, and I can't enjoy it because every time I'm watching the match, I'm just watching the Harman's knee. It's going this way, it's going that way, which way is it going? So Harman came to me about 6 months before the Tokyo Olympics, and I remember at that time he was distraught because he'd had an ACL injury, he'd had a meniscus injury, which is the shocker in the knee, and he was very worried because he said that, look, if I miss this Olympics, I don't know if I'll play the next one. And whenever we do any ligament surgery, we usually tell people that it takes about 8 to 9 months to get back to competitive sport. And we only had a 6-month time frame. So I explained that to him. I said, look, we only have 6 months, and I don't think you'll be ready for this Olympics. And he's like, don't worry, leave that to me. I'll get ready. You just do the surgery and rest everything, leave it to me, and I'll ensure that I play the Olympics. So I said, okay, against my advice, let's do it. And so we fixed his knee, and 4 months later, he went to Bangalore to the national camp. After that, he took a flight to Tokyo to the Olympics. And if you remember the last Olympics, he was the leading goal scorer for India.
Yes.
And he was one of the big reasons for why India brought home the bronze. And now, after that, he became India Player of the Year, then World Player of the Year. And then he got promoted to the captain of the team. He was vice captain before. And this year, back-to-back Olympic bronze medals after a long time for hockey. And again, he was the leading scorer throughout the tournament. So I think we talk about, a lot of patients come to me and ask me that, look, will I ever be back to my normal self? Or will I be able to play sport again at a normal level? And I said, just look at Harmanpreet. So not only did he exceed what he wanted to achieve, but he continues to do that and perform at a very high level. So I think his story is really a remarkable story of willpower.
True, absolutely. And talking about recovery, because you said that Harmanpreet, he really put in that extra effort to really recover in time because he was so passionate. Of course, yes. Passionate maybe is going to be an understatement here. He was so professional also at the same time, to get the recovery done in time. But maybe it's a little bit tricky question for you. Now, you being a doctor, obviously you also want to maybe play it safe at times, right? Because you were seeing no matter what, a top-notch, a player like Harmanpreet, who of course was anyway going to be indispensable for India's, success at the Olympics. But at the same time, if somebody goes through a phase wherein he's maybe overworking on his recovery, which maybe at times for you as a doctor, you might say, okay, this is a little bit more. Does it happen? I mean, how do you strike a balance between these two, wherein you want your athlete to really recover in time, but at the same time, if suppose if he is really, after all, he's also coming out of a ACL injury, which is that grave. At times, maybe he is also overworking. So, how do you really strike that balance wherein you are saying, okay, Harmanpreet, just slow down a little bit, but at the same time, at the back of your mind, you also want him to play for us?
See, I think for a sports surgeon, right, which is the number one thing is getting our players back to sport, and not only getting them back to sport, but getting them back to what we call sport at a pre-injury level. So that is the level that they had before the injury. That's the ultimate goal for any sports surgeon. And I think that the vast majority of us, we strive towards that. And we, in about 70 to 80% of cases, we achieve that. They get to back to sport at the pre-injury level. Some of them have dips after going back, which is natural. But the vast majority, I think, still get back to sport at a good pre-injury level. Now, the whole process starts before the surgery. So, or before, whatever treatment we're giving them, is they come to us with a specific goal in mind, which is, I've got this tournament, which I must go to, and this happens in X amount of months. So we really have to do a little patient education thing with them and tell them that, look, I understand this is a very important tournament, but you must understand that in your current knee situation, if you play this tournament, you're going to end up destroying your knee further. So we have to undertake this sort of treatment for this, and it's going to take, Y amount of months. Now, sometimes X and Y match, and it's wonderful, right? But sometimes we find that the amount of months we want to give them is usually higher than when their tournament is. So I think that starts before any sort of treatment. We just have to, explain to them that this is the anticipated recovery time. This is how long it's going to take. And we can't overstress it or push it too soon, because what happens is you may end up playing one tournament, but at the end of it, if you end up damaging this knee again, then you're going to be ruled out for a prolonged period of time after that. So I think that's that little back and forth that goes on. And in a way, I would say it's like establishing, it's a power play, right? So they want to be the dominant force and guide the treatment. You as the doctor want to be the dominant force and, tell them that this is the treatment. And somewhere both of you need to meet somewhere in the middle, more towards my side, but somewhere in the middle where we tell them that this is the safe time for you to get back. And for us, that's the most important thing. Now, I would say that 95% of players listen to that and they adhere by that, look, okay, he said this, he's done my surgery, he's told me that this is the amount of time I need before I can safely go back. And it's not just a time criteria. So whenever we're putting an athlete back to sport after an ACL surgery, for example, it's not just the time that's important. So some people will hit milestones earlier. Some people will take a longer time to hit their milestones. So what we do is something called return to sport testing. So we get them to undergo these hop tests. We do these dynamic measurements of their hamstring and their quadriceps. We do a battery of these tests, and basically the simple rule is, which we explain to the players as well, is that if you fail one of them, the chance of you re-rupturing is 30%.
Oh, really?
And if you clear all of them, the chance of you re-rupturing is 3%. So there's a huge difference. So we tell them that, look, you've failed this test, and let's give it some more time. Let's work on this thing which is lacking. Let's give it another month or so, and then we'll do the test again, and we'll see where we stand after a month. So, and we often have that in our practice. We get these players coming in, say at 8 months, and they'll be like, "You told me 8 months." And we said, yeah, we told you 8 months, but you just haven't achieved the milestone that we want you to achieve. So if you fail these hop tests or the other tests, then if I put you back, you're gonna re-injure your ligament, and then you'll be more unhappy. So I said, give me another month. Let's take another month. Let's work on this, and then we'll do the test again. So yeah, that sort of little thing continues daily.
Yeah, true. So, I mean, even post recovery is so important. There is so much of science behind, like you said, right? I mean, it's not like, okay, you just recovered. Okay, I mean, if it's not athlete, for a normal person, of course, he can take his own sweet time. But at the same time, for an athlete like, who has a tournament, big tournament coming in, so that becomes, kind
Yeah.
of a different scenario. Like you said, the milestones that,
And
yeah.
as I said, 95% of people listen to us, 5% don't. So I have an interesting story, which is this circle kabaddi player. So he he never showed us after his
Wow.
surgery, and he basically just rehabbed it, did some things on his own,
Wow.
wasn't really much in touch with us. And
Hmm.
then 4.5 months after his surgery, he sent me a video of him winning the Kabaddi Cup. And I was like, what are you doing?
Oh.
So you're 4.5 months down from your surgery. And luckily, touch wood too, today, he's 3 years down the line now.
Wow.
And he's still, winning all the local tournaments, the state tournaments. So I mean, that's sort of a miracle thing, which is, 4.5 months. I don't condone it, but he just did
Yeah.
it,
He
and
did that. Yeah.
luckily it worked out for him.
Yes.
Yeah.
Yes. Yes. True. 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 Yes. Now still sticking to the Olympics a little bit, because you are not indirectly, so to say, you are attached to Olympics, through your athletes. If you really have a SSDA performance of the Indians overall, are you satisfied? Maybe could have been better, kind of a situation, or you're not satisfied. Where do you think India stands? This is a totally sports oriented
So
question, because you are ultimately our Olympics doctor. So.
So I think there's two things, right? The first thing is that we're the biggest country in the world, and for us to be bringing home 6 medals is just not good enough. So I mean, China, we say that okay, but China's done this, China's done that. They're autocratic, and they're able to achieve their goals that way, and we're a democracy. But at some point in time, we can't keep using that same argument, right? So I think that since the last Olympics, what I've seen is the amount of enthusiasm for sports has increased a lot. There's now many more professional leagues, including televised leagues. So there's a huge interest for sports, and it's not like people aren't playing. And people say that, okay, I remember watching these memes after the Olympics that we tell our children that you only have one period for sports a week, and we expect medals. But
Yeah.
at the end of the day, remember we've got 1.4 billion people. So I'm sure, we can weed out and find, high level athletes from them. And there's a lot of companies now that are doing great work. Like, for example, JSW through the Inspire
Absolutely.
Institute of
Yeah.
Sports, they're doing a wonderful job in terms of providing infrastructure. Odisha government does a wonderful job for hockey. So there's a huge amount of money which is going into it. There's a huge amount of improvement in performance which is happening, but that's not reflecting in medals. And at the end of the day, if I put my doctor's hat aside and I look at this purely as a citizen, I'm a taxpayer. I'm paying money, which is contributing to, all of these
Yes.
activities
Yes.
of them living in
Absolutely.
the village,
Yeah.
paying
Yeah.
for their food, all these things. I want medals, and I want a truckload of medals because
Yes.
I'm patriotic, and I want India to shine at the global stage. I think as all citizens, we want that, right? So for us, the biggest country in the world, to bring home 6 medals, I think that we can do so much better.
Absolutely. Yes. Rightly said. Yes. True. True. Now, coming back to ACL, which is your core competence, competence, of course. Can you please take us through the different stages of ACL, the different grades, and also how do you identify that, okay, this is the stage, this is what is required to be done, and then how do you actually treat it, accordingly? Because I'm sure there are different stages, right? I mean, one, two, three, kind of. So how do you actually go about with your entire thing?
So there's a lot of classifications, right? The most simplistic classification is we just divide it into three types or three grades. So there's a grade one injury, so this is your ACL, and a grade one injury is just a stretch. A grade two is a half tear, and a grade three is a complete tear. So if you have just a stretch of the ligament, you really don't need to do anything. So you just let it settle down, a little bit of physiotherapy, and you're back into your normal life sooner rather than later. If it's a grade two, we divide them into two types. One is a low grade tear, which is less than 50% tear, and one is a high grade tear, which is more than 50% tear. The low grade partial tears, they 99% of the time they don't require any intervention. They do well with just, conservative treatment or non-operative treatment in the form of sometimes bracing, but the majority of time just rehab, physiotherapy, and getting the athlete back. For high grade tests, again, it depends if you're an athlete or a non-athlete. For usually the non-athletic population, they tend to compensate well and cope well. They're what we call copers, because they're able to cope with their problem. Whereas athletes are definitely non-copers, so they don't tolerate high grade partial ACL tears very well. So for them, we treat them as complete tears. And complete tears, they're the ones that require surgery. Again, not every complete tear requires surgery. And I would say out of every 10 complete ACL tears I see every day, about 9 would require surgery, but there's still that one patient that doesn't require surgery because they're low demand. They're not doing anything in their life, which they require a ligament for. And they're able to cope with it and compensate for it. So those are the ones that we just encourage to, work on their muscles, get the muscle strengthened to bypass the problem. So it's not a hard and fast rule that you've got a complete tear needs surgery. I think it has to be tailored according to the demands of the patient and what sort of goals that they're willing to achieve and sort of modifications they're able to make in their lifestyle. My boss in Australia, where I was, so he's one of the godfathers for hip surgery in the world,
Oh, oh,
and he sustained a ACL tear, and he
oh.
never got it operated. So, and because he's low demand, he doesn't really do anything. So he used to just walk around his clinic and do things like that. So at his stage, his rationale was the same. He said that, look, what do I need an ACL?
Yeah. So, like you said, it depends on the expectations of the individual also, right? Because if somebody is an
Yes,
athlete, his expectation is totally different. The body work, the amount of work that you're going to put in the long run, that's so obviously,
yeah,
that will be different. And for a normal non-athlete who can, it's all about management. I mean, if you can manage it through the entire life, I think even it can be managed, like you said. Um, so
yes.
yeah, so I mean, I was actually seeing a tennis match where Grigor Dimitrov was up against one guy, and then I think he had a ACL tear. The amount of screaming that came out of him, I mean, I guess it's very painful, right? I mean, if it really goes at a very high level,
It is. So there's the other side to it, which is if you watch the 2022 or 2021 NBA finals.
oh,
So Klay Thompson, Golden State Warriors. So
uh,
he had an on-field ACL tear, and after that, so if he exits the game, he's technically not allowed to return to the match. So
okay,
he had an ACL tear, got up, shot a couple of free throws so that he could enter the game back in again and then exited.
wow,
So each individual is different. And usually when you get that ACL tear, the first thing that happens is you hear a pop and your knee buckles or gives way. And the majority of that swelling that people say, that usually comes overnight. So that swelling doesn't come straight away. It usually takes a few hours for that swelling to set in. And they usually notice it overnight or the next day morning when they wake up from their sleep that, look, my knee is swollen and there's something wrong with my knee. So I think the pain part of it, so you get pain initially. And really the worrisome thing for a lot of people is they get pain, they get some amount of disability that they're not able to walk properly. But over the next 2 to 3 weeks, that pain settles down, the swelling settles down, and they feel that, look, whatever it was, it wasn't that serious, and now I'm back to
oh, okay,
normal.
uh-huh.
So then they push it. And once they push it, the knee buckles again. And this time, it's not just a simple ACL tear. It takes, the meniscus or the cartilage with it, and suddenly you've complicated your injury. So, and I see this story every single day in my practice.
Right, right. So the right diagnosis is very important, right? I mean, it might
Yeah.
look like, okay, if my pain is subsided, okay, fine, I'm good to go, but you are just aggravating the entire
And
thing. Yeah, yeah, true.
true, true. And as I said, the majority of them are, non-operatively treated.
Mhm.
So it's there's a phobia in our public, which is that if I go to the doctor, I'll end up getting operated. But it doesn't work that way because
True, yes.
we're only going to operate something that requires an operation.
Now that you have, of course, handled different athletes from different sports discipline. In fact, I think you have also handled uh, Brigu Vangshi, the captain of basketball of our
Yes.
basketball team. Yeah, yeah. So basketball is one, like you already mentioned, gave an example on the NBA, and then of course hockey players, and I guess you'd have handled different, at least from different sports discipline. Which do you think? Of course, this might be a very subjective kind of thing, but still, which sport do you think would have more ACL tear? Because, for example, tennis, you require a lot of side movements. You go to the net again, you have to come back. If there's a lob over your head, then again, football, somebody might stamp on your knee, and that's a different ball game. And hockey, of course, is again. So, generally speaking, which
Without
do you think? Yeah,
without a doubt, kabaddi.
is it? Oh, really? Okay, okay. Yeah.
Hands down, kabaddi. Kabaddi wins every single day of the week when it comes to ACL
Uh-huh. Okay, okay.
injuries.
Why so?
The
What is the
amount of
reason?
ACL injuries that come in with kabaddi players that come into our practice and they have injuries. There's a truckload of kabaddi injuries, and the second one would probably be foot's injury, right? But that was derived from the West, so that was derived from the European literature, which was,
Oh,
again, football's their sport, and they used to see a high prevalence. If that same name had to be given from the Indian subcontinent, we would have definitely named it Kabaddi. So
Kabaddi. Okay.
the Kabaddi beats football for ACL injuries every single day.
Oh.
And then at number three would be wrestling.
Okay, okay, true, 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 okay. That's what we
Yeah.
saw with Vinesh also just before the Olympics. She was had an ACL tear and then she recovered in time, I guess.
Yes, that's
Yeah.
right.
So with Kabaddi,
Yeah.
I guess it's also because of not only because of twist and turn, but also people pulling the legs and the knee getting
Contact.
the
It's
contact.
contact.
Yeah, yeah,
Yeah,
contact.
direct contact injuries. So
Correct, correct.
the vast majority of the Kabaddi injuries are direct contact because in Kabaddi, as know, uh, versus defense and the right they can turn to escape, and the stoppers get injured when they go in for the leap to lock the radar. So those are the two instances when a lot of twisting and turning is happening off the knee. And it's not just a twist and turn because football gives you a lot of twists and turns. This is twists and turns with high velocity contact
Contact. Yeah.
with huge bodies doing high velocity contact. So kabaddi players are huge guys and girls, and it's a big unit that's doing a high velocity contact.
True, 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 true. And ultimately, the knee is doing all the workload.
Yes,
Yeah.
yes. The knee, and then probably the second injury for them is ankle after knee.
Oh, ankle. Okay, okay. Yeah, that's right. Yeah. Just now, I gave a reference of Vinesh Phogat still sticking to the Olympics. We saw what happened with Vinesh. So, that's discussion. I think
Yeah,
we can't
yeah.
ignore. Basically, it just happened. Of course, we lost at least a sure shot silver, and maybe she was looking good for a gold actually. For 100 grams, but then that's the way the rules are clear. You have to make weights. That's one instance, one sad instance among all the hits and misses and the Olympics we have seen. Of course, a lot of fourth places we have already seen. Second instance, I don't know if it really makes sense, but anyway, it's my personal thing. Honestly, Mirabai Chanu happens to be one of my favorite athletes. She did mention that because she was going through the third day of her period, and that's where maybe she lost on the medal. Now, giving a slight reference, for example, somebody like Serena Williams, who of course is retired, who is undoubtedly one of the goats of tennis. She has won 23 Grand Slams by the time she retired. And among non-Grand Slam tournaments, if you see WTA 1000, WTA 500, she already won a lot of them. And at the lower end, also when she grew up as a player, she also won a lot of titles, right? Now, for a Grand Slam, for example, she invariably had to play one match every alternate day over a period of 2 weeks. For a non-Grand Slam, she would have
Yes.
played over to win the title, I'm saying. And for a non-Grand
Yeah.
Slam tournament, she invariably had to play every next day, over a period of 1 week. So that way, if you really see, she obviously would have gone through a lot of such cycles, right? So Do you think we're missing something here, wherein, of course, I don't think we can expect Vinesh or Mirabai Chanu to be that educated. I mean, let's be honest, that's why we've got, doctors, we've got, dietitians, we have the whole team going with them. So do you think there is something that we missed out in terms of the right education being given to our supreme athletes? Because if you ask these athletes, they're going to work hard the entire day. But at the same time, the coach has to come. Okay, just it's time for recover. Let's take some rest and then we'll get back. What do you see from the entire these two instances of Vinesh and Mirabai Chanu?
So yeah, so both the instances are very different, and I'll address both of them. You cannot blame periods. She's playing so much. I don't think I've ever heard any other athlete say that my poor performance was due to my period. So simple as that. I've never heard that in sport. And, I watch sport. This is my job. I watch sport. So I've never heard an athlete come on nationalized television and say that I did not perform because I was on a period. So I think that's just not good enough. So you cannot say that to the public. And, at any given point in time, there are so many leagues that have been, there's basketball leagues, tennis leagues, football leagues, and we're just talking about female athletes here. Now, these leagues run for, 2 to 3 months, right? Which means that on average, any player would undergo 2 to 3 periods during that time, right? Which means that they would be missing 2 to 3 matches during that time. So how many players have you seen who are female athletes who are playing in team sports miss a game due to a period?
True, yes.
Not one. I've never seen one leave a game because she has a period or sit out a game. No shame in it. You just declare it that I have a period and nobody would judge you for sitting out. But I've never seen one female athlete blame a period for a performance or even sitting out of a game. So if you have an abnormal menstrual cycle, yes, definitely that can impact and hinder your performance. But just being on day 3 of your period, according to that, every single female athlete can use that as an
Yeah,
excuse.
yeah. I mean, then that it
And
becomes a
we've
matter
never
of
seen
chance, matter of luck.
one.
At the end of the day, I mean, somebody will win the gold medal if she's not having a period. Somebody will win the bronze medal if she's on the maybe lower end of the period cycle.
Yes,
Yeah,
yeah. I mean, that should never be an excuse for poor performance. If you've performed poorly, I think accept it that, I performed poorly. But I don't think you should blame your period because that's sort of the message it sends to, younger female athletes who are coming up through the system as well, is that this is, a fallout mechanism. This is something that, if I am unable to perform, I can always say that, oh, look, Mirabai couldn't perform due to her period. So how can you expect me to perform? And I think that for our children, this is not the sort of thing that we should be teaching them. That I would want my daughter never to, blame that as a reason for poor performance. If she didn't perform, she didn't perform. That's it. So, but it should never come down to the point that
yeah,
I had a normal menstrual cycle, and because of that, I had poor performance. I think that's not good. Vinesh, a very, very different story. I think hers is a story of just complete mismanagement. So uh, every single athlete at the Olympics has, this is the first time that people had to do double weigh-ins rather than a single weigh-in.
yeah.
So the first Olympics that happened in. And now, how many other athletes throughout Paris Olympics were disqualified due to it? Not one,
Yeah.
except our athlete.
Yes, yes.
So if every other wrestler, and I would say there's at least 200, 300 of them who are competing in the various categories, male and female, who are undergoing double testing. If 200, 300 wrestlers across various disciplines are able to manage their weight, how come you are not able to manage your weight? So, and I think that's not her fault at all. Her job is to perform. She's an athlete. She's there to give it her all, and she's there to perform at the highest level possible. It's actually the fault of the support staff. They're the ones who should be on top of her weight. They're the ones who really need to monitor it. And they're the ones who really need to make sure, that We're keeping a good eye on this, and whatever they're putting into her body in terms of nutrition is also balanced by output so that they can control her weight during the day. Now, I remember at the end of it, I heard an interview from one of the support staff who was saying that we even tried cutting her hair
Yeah.
and reducing 100 grams that way. That's ridiculous. According to this, then at the end of the tournament, every athlete will be bald.
True, yes. Absolutely. Yeah, I mean, those both the instances were, even though different, but very sad, at a different angle, actually. Now, yes.
And again, I think this is support staff related
Yeah,
issues.
support
So,
staff.
and this comes down to my point about how we as taxpayers are paying for these support staff. We're the ones who are actually funding, them going to the Olympics, staying at these fancy villages. And, I think that as taxpayers, we also demand, better answers from them. And we should never be missing out on a medal just because, the support staff wasn't good enough to manage weight.
True, absolutely. And also, I mean, I guess India, I mean, as a country, we are more emotional rather than being scientific and practical. Because,
Yes. Yes.
for example, a few of my female friends, after listening to this interview, might say, "तुमको period के बारे में क्या मालूम है?" You know. But at the same time, we're not talking about commoners here. We're talking about
Yeah,
top-notch athletes like Mirabai Chanu, very
exactly.
top-notch athletes who would have worked day in and day out, for a training, even after going through the injury, to be there after 4 years, right? So it's not one of those commoners that we're talking about. So I think we didn't manage well in both the instances. Yeah.
I think the common thing you can say to your friends who think that way is that, I think that I mean, I'm sure you do as well. We
Yeah.
respect women a lot,
Yes, of course we do. Yeah.
and we respect, they have to endure it every month. But at the same time, I've never seen a female athlete blame a period for lack of performance. So,
Yes.
I think that is the point I'm trying to make. That's what we're trying to
Yes.
push.
True, yes. And that too, for a sport like weightlifting, of course, you've got the Asian Games, the Commonwealth Games, Olympics, and then the World Championship, and a lot of other things as well. But here it's about managing, not unlike a tennis player, wherein you have to play at least virtually every week at times, wherein, so I think it
Yeah.
could have been managed a little bit better.
Second day for some tennis players. I was saying for tennis players, almost they're playing every second, third day
Yeah, every
for
second.
an entire
Yeah.
tournament.
So that way,
Yeah.
I mean, they should not have won any of those titles, because invariably they would have gone through those cycles. Yeah.
As you said, I've never heard Serena Williams say that.
Yeah.
And I think that's what distinguishes the great players from the good players.
Yeah. True. Yes. I mean, at the end of the day, I think that's what India also still some way to go when we evolve as a sports nation. As a sports nation. When we talk about sports nation, it's not only about athletes. It's about the ecosystem. Wherein somebody knows about sports. Somebody knows the sports nutritionist knows about what best for the athletes. Likewise, in case of Vinesh. So to say, it could have been managed much better. So it's about the entire ecosystem, not only athletes, because athletes at the end of the day, they know how to run. You ask them to run, you ask them to work hard, they will do the entire day, right? But then you've got to support stuff to really help them out, to educate them, because ultimately, if you really see all these girls, all these supreme athletes, they would have maybe didn't complete the 10th or the 12th, if I really have to look at it that way, right? That's why you've got so many people support stuff, helping them out and making them more educated scientifically, right?
Exactly. The support staff system needs to just be so much better. I think that there's no this Olympics. I think the one thing that we all learned was we need better support staff. So we need, and if we're spending so much money and so much taxpayers' money, we demand better support staff. We demand, give them the best. If they're going and they're representing India in front of a world stage for an event which happens once every 4 years, provide them the best of the best.
Thanks a lot, Doctor. I mean, for your great insights, and thanks a lot for taking care or good care of our athletes. That is so very important, because athletes will obviously do their own stuff, but then we need the good doctors like you to really take care of their knees, to take care of the ACLs. Thank you so much. And we have already seen live case studies, at the recently held Paris Olympics. So thank you so much, Doctor, also for coming in and giving all your insights. And I'm sure you'll only get more busier for the Los Angeles Olympics now. And thanks a lot for coming in, and please keep on doing your great stuff, and the great deed that you're doing for our entire country, for the sake of athletes, for us, for all of us. And may we bring more medals as we go ahead, and we'll always be greatly indebted to doctors like you.
Thank you so much. Thank you for having me. It's been wonderful to be a part of your show.
Thanks, doctor. Thank you so much. Thanks.